There we go. All right. So, hello, everyone. My name's Autumn. I am a project manager for the Canadian Coalition for Green Healthcare. And on behalf of the Coalition, the Canadian Association of Nurses for the Environment, and the Ontario Nurses for the Environment, I would like to welcome you to our fourth Nursing Week event, Shaping a Sustainable Future Nursing Education for the Environment. Like I said, this is our fourth event. We've already done three amazing events this week, and we have one more happening tomorrow. All of these events are recorded. We're recording this one today, and the recordings are going to be sent out to all of the registrants probably tomorrow afternoon. So if you missed a session, don't even worry. You're going to get the recordings for all of them. But yeah, this year's theme is the power of nurses to transform health, and all of our events have been looking at that from the lens of planetary health. So throughout the event today, please use the chat function for any technical issues you may be experiencing. Also welcome you to introduce yourself in the chat. Let us know where you're coming from. We love to see who's joining us. And please use the Q&A function for any questions you have regarding the presentation. Our panelists will be answering the questions at the end of the event today. I'm now going to hand things off to Ashley for the territorial acknowledgement and to introduce today's speakers. Take it away, Ashley.
Awesome. Thanks, Autumn, for such a warm welcome. Hello, everyone, and welcome. We are very excited that you've chosen to join us today for this, for some of us, lunch and learn, for some of us, the end of work and learn. But we're all here to learn, which is wonderful. My name is Ashley, and I will be co-hosting with Autumn, and I'm located on the unceded and traditional territories of the Musqueam, Squamish, Tsleil-Waututh, and Coquitlam peoples, otherwise known as Burnaby, BC. I would like to quickly share my screen with just a single slide here for a longer land acknowledgement, because I would like to start in a good way before we begin and acknowledge that all of us who work and live on Turtle Island are on the traditional territories of the many First Nations, Métis, and Inuit peoples who inhabit and continue to care for these lands. We honor their rich cultural heritage, traditions, and stewardship of this land. We recognize the enduring connection that Indigenous peoples have to the land, and we commit to fostering respectful and positive relationships, not only with one another, but also with the land itself. We make this acknowledgement with the recognition that all healthcare professionals have a responsibility to learn the devastating impact that colonization has had on Indigenous peoples past and present. We recognize our duty to respond to the calls to action of the Truth and Reconciliation Commission of Canada. And as Autumn said, we'd like to invite you all to use the chat right now to let us know the names of the lands and territories that you are tuning in from today. That was the only slide that I actually had. So as Autumn said, today is the fourth webinar and penultimate session of the series, this week-long series. So there is one final webinar for you to attend tomorrow as well if you are interested in attending another one live. Today, we're going to hear from four truly visionary nurses who are working to bring education on climate change, planetary health, and sustainability into nursing curricula, research, and practice. From BC to Ontario, these nurses are shaping the future of nursing education in Canada and leading the way in promoting environmental conscientiousness and sustainable practices among healthcare professionals. Yes, I am repeating a little bit of what Autumn said, but for this session, we're going to have our speakers present back to back to back. And then at the end, we'll have a panel style question and answer period at the very end. Briefly, just for some housekeeping things that I think weren't mentioned, if you would like captions, you can click on the captions button at the bottom of the Zoom screen. And we would be delighted if you would ask our speakers some questions. Just please use the Q&A button, which you should see at the bottom. And direct your question towards either a particular speaker that you would like to ask or towards the panel more broadly. Okay, without further ado, I am honored to introduce our first speaker, Dr. Jack Avanthe-Struce. Jack is a nurse educator, researcher, and leader in planetary health and health equity. They are a professor at the Université de Saint-Boniface in Winnipeg, Canada, where they teach community health, mental health, and perinatal nursing, and contribute to the development of socially responsive nursing curricula. They are a past president of CANE and currently serve on multiple national committees related to climate change, environmental justice, and nursing education. Okay, Jack, the floor is yours. Thanks for
Hi,
starting.
everyone. I have a hard time when I can't see everyone, but nonetheless, I will start. So, thank you so much for the introduction, Ashley. I also wanted to introduce myself a little bit less in the academic sense. So, I'm Jack. You can call me Jack if that's really what you want to do, but I really dislike it. Just call me Jack. My pronouns are they, them, yell. And I come to planetary health in a different way than some of the other people. So, planetary health to me has given me the language that allows me to speak who I am in my profession because I had the privilege of growing up in a small Métis community in Manitoba, surrounded by three First Nations reserves, among them Saugeen First Nation. So my connection to the land and others has always been very, very strong because I was able to participate in Indigenous ceremony and practices and that interconnection from the time I was very younger. So what planetary health has given me was a language and a common language that other people can understand. And so, as you heard from what Ashley mentioned, to me, planetary health education to be done in a good way needs to have certain things grounding it. And among that is that ability to recognize that it is rooted in Indigenous ways of knowing and perspective. So, planetary health comes to us from the many people who've already been thinking and doing the work in planetary health, specifically place-based. So as I'm going to go through some of the initiatives that have been done and the tools you can use within planetary health, I really want you to think of that. So when we're thinking of planetary health, even though it's a big concept, we also want to recognize that when we're speaking to students in a way that they can understand, we want to think about different ways that the students can engage more concretely. So experiential learning, like integrating those land-based initiatives, also grounded in transformative learning, which allows students to like take different perspectives in their mind and reconcile. So one of the examples that I'm going to show you that is grounded in transformative learning and respecting multiple perspectives from a planetary health perspective is the Introduction to Environmental Racism for Nurses course. So this course has been on the go now for quite a while, and it's really to empower nurses to really think about environmental racism and the health inequities that exist in Canada. So this is a course that anybody can access. It's open access is one of the conditions to have the funding, but it integrates heart-based, land-based, and transformative learning. So it's a really good example of how to give a taste of the underpinnings, a little bit of pedagogy, and the way to start thinking and critically reflecting as we walk on this journey. Another really useful thing that we can use for education, whether it be in our nursing pre-licensure programs or even as a nurse educator, we've created a nursing toolkit for planetary health. So essentially, this toolkit was designed so that nurses, wherever they were working, mostly in tertiary care, could have the information and resources to then create change at a local system to eventually reach sustainable, resilient, and low carbon health systems. There are a few other things that we do that I've done. One of them is, okay, we have these big things. Well, how does it actually work in practice? So one of the things for educators, if you're looking, well, it's all well and good that we think about systems and sustainability, but what does that mean when I'm like in front of a person? How do I integrate planetary health in my point of care assessments? So one of the things that we recognized is that very little point of care assessments tools actually used and evaluated planetary health risks, let alone environmental equity or climate issues during the transition to parenthood. So when somebody decides to have a child, when they're pregnant, or when the child is up to 2 years old. So this tool was developed and it's now on the Front Saving Perinatal BC services for healthcare providers to use, as well as pregnant people and their families. And essentially, this is a point of care assessment tool that anybody can use that works with people that have young children that want to become pregnant. And it's grounded from a planetary health focus. based in health equity, and also integrates cultural safety. So it's one of those things where it's like, if you're trying to teach, well, how do you actually do it in practice? This is a good example. For the next thing, it's very, very much on one issue. But when we think about planetary health and we think of everything that is interconnected, radon gas, for example, in Canada with the melting permafrost, the people that are more at risk for radon gas having in their house is actually changing, and it's moving towards the north. So this one is an example, a concrete example that you can show and use in your own practices to learn about different environmental factors. I'll put everything in the chat as well. So another thing that we also like to integrate and is really good for education is Cape and Kane has also created information sheets. So this way, in certain times of year, certain things are a bit more concerning. So wildfires or heat extremes or that kind of thing. So there's a bunch of resources and information sheets. Really awesome. I don't know if any of you guys are aware of them. They just launched May 6th. So quite a few of us from Kane have worked on it, either in the creation or its revision, but there are now planetary health curriculum guidelines. So this means if you are wanting to integrate planetary health in your pre-licensure curriculum, we now have guidelines. And there's several articles that are coming out that speak to the pedagogy that go with it. Let's say you're like, oh, it's all well and good to have this guidebook and curriculum, but how do I actually learn how to teach it in a good way? That's where one of the other aspects that I've been really working on is creating, I shouldn't say standardized, but like creating educational content that can be delivered to nurses and other healthcare providers that really introduce place-based planetary health nursing. So we've created a workshop, a micro workshop, and we are planning on delivering a 6-week course for CAUSE and the Canadian Association of Schools of Nursing. And we've partnered with the Nursing Practitioner Association of Ontario to also deliver a 6-week course. So with this, the idea is to increase capacity, because one of the things that we've noticed is everybody knows planetary health is an issue, but people don't know how to teach it and they don't have the basics. So this is in response to that. So this is like the first workshop we're creating, and then we'll be creating delving deeper, and then perhaps a certification for that as well. And the idea with this, with Kane, is that we want to like create a train the trainer model, right? So like once you've done the workshop, let's say you want to be able to deliver it in your own space, then you can participate in the trainer, and then you would then be able to use the materials in a good way. Another cool thing that's happening in the pipeline is the first planetary health book is going to be coming out, hopefully in May 2027. So it is basically Nursing for Planetary Health, Advancing Place-Based Initiatives. And this book, I'm kind of biased here because I'm the lead editor for it, but I am very much, you see a need, you fill a need, right? So I was so frustrated with the lack of references and guidebooks and something that could show me how I could teach with activities and all that kind of stuff. So the upcoming book, Nursing for Planetary Health, Advancing Place-Based Practice, will hopefully respond to that need, and it integrates all of those pedagogical modalities in the activities and stuff as well. So I think I'm done. That was a lot of information. I'm going to throw all of those links in the chat for you guys to access as well.
That's awesome, Jack. Thank you. Thank you for getting us started in such a good way. I really appreciated the choices that you made of which resources to include. Out of all of them, I think that, and I think something you're excellent at in general is taking what can sometimes be abstract concepts and making them really tangible for people. And yes, Jack is going to send the links in the chat right now. And justice and equity centered resources and initiatives that are actually like kind of approachable and like you can use them in your everyday life. On a personal note, I have enrolled in the CHNC workshop, the place-based planetary health workshop. I'm very excited for it to be surrounded by some like-minded, environmentally conscientious nurses. And if you are a nurse and you're free and you are close to the West Coast next week, I encourage you to sign up as well. We can hang out. talk about, geek out about all things environmental. Okay, so we are right on time. That leads us to our next speaker, our wonderful next speaker, Rob. Rob is a registered nurse who has worked in a wide range of nursing settings, including hospital, community, summer camps, mental health, and education. He is currently the chair of RNAO's Ontario Nurses for the Environment. His current advocacy focus is getting planetary health included in CCRNR entry to practice competencies for for the nursing profession, with the next step being inclusion on the NCLEX RN exam. Please take it away, Rob.
Thanks, Ashley. So, my name is Rob Samuelak, and I'm calling in from Ottawa, which is on the unceded Algonquin and Anishinaabe territory. And as Ashley mentioned, I'm going to be discussing the inclusion of planetary health into entry-level competencies, why this is important, and then I'm going to use my story on to describe how this is developing. So, I'm the chair of RNAO's Ontario Nurses for the Environment, and this is my 4th year in the role. So when I started in this role, I had just freshly come back from Scotland from the COP26 United Nations Climate Change Conference, and I was really fired up and had a lot of urgency, and I wanted to make as much impact, as big an impact as fast as possible. And I kind of fell into this role. So our team started collaborating with many other environmental NGOs, including CANE and the Coalition, among many others. And we got to work uh, trying to do a lot of campaigns, political policy related campaigns. Um, but I found that within RNAO, I was largely known as the environment guy, kind of got that little label there. And the same kind of thing in the workplace. It was kind of a fringe issue within the general nursing profession. And we, everybody on this call knows how climate change and pollution are having a major impact on human health, but that's not largely understood throughout the profession, or at least well, it's growing. It's growing a lot right now, but it historically it hasn't been. And a story that epitomized that for me was when I was in nursing school a decade ago. One of my favorite lab instructors brought in Tim Hortons hot chocolate and Timbits for everybody. And then after the lab, she took the container and started jamming it into the garbage can. There was a recycling bin right beside it, but she was putting it in the garbage can. And she said to me, "You can't be a nurse and an environmentalist." And for me, I think that was like I think for her that was like a protective mechanism because we all know how much waste healthcare makes, and there's a lot of single-use plastic and packaging, but this really stuck with me. So in my first 2 years, we did a lot of political policy campaigns, but we kept running into the same barrier. There was very limited political will to act. The general population generally has shown, well, the majority of Canadians have concern about climate change, but the voice is not loud enough, and it is not loud enough to drown out the huge amounts of money that the fossil fuel companies are pouring into lobbying. I had spent a lot of time speaking at numerous events, lecturing at universities, and talking about how environmental degradation was so deeply damaging to human health. But it's been a very small handful of us speaking about this. So we hear time and again that nurses are ranked the most trusted voice. So that means that we have so much potential within the profession to make societal change on environmental issues and planetary health. But so my focus shifted from those political policy campaigns to, okay, we really need to activate the nursing voice. And within RNAO, which is it is a mainstream nursing association, we really raised the profile of planetary health and environmental issues, and it became one of the 5 pillars for the election campaigns last year. So it's becoming more of a mainstream issue. But beyond that, we really need it to get into the nursing schools. So at first, we started precepting a Greening the Lab initiative which was a fourth year project at Algonquin College. And we did this for 2 years, and then last year I did it in the capacity as a clinical instructor. Back in April of 2024, we created the Greening Nursing School Community of Practice. And its purpose was initially to create a space for those in nursing education to collaborate on similar projects from across many nursing schools across the province, across the country, and we've had quite a few American nurses as well join in. So we learned that these projects alone, though, these small little projects within the nursing school, they weren't enough. They were great, but they weren't enough. We needed to start including theory into nursing education. The term planetary health was really taking off, so we adopted this vocabulary and this framework and started talking about how do we include this into nursing education at the various schools that were present within the community of practice. Um, but one of the barriers that kept coming up in these meetings was that was no time in the curriculum to discuss this theory. The curriculum was jam-packed, couldn't get anything into it. So, but we knew that this was essential with wildfires and heat domes and so many other things and evacuations of all communities. Nurses today and tomorrow need to know about planetary health and how this works and incorporate it into their practice. So we needed to develop a strategy to break through this curriculum barrier. And we needed a mandate for the nursing schools to actually include it in the curriculum. So before my time with this, Barb Astle from Trinity Western, Kane, and Kazan, she already had gotten planetary health introduced into the Kazan entry to practice competencies back in 2022. But we know that this is not being widely implemented. A study was done by Dr. Astle last year, and it showed that it is not being widely implemented. So this means that we just need a bigger stick. For that means we kept discussing at these meetings and we came up with a strategy. Okay, how do we get this into the curriculum? Well, let's get it. There's there's the regulatory bodies through the colleges, there's NCLEX, or there's just the option of opting in as the school for the school at the school level. But we know that opting in is not really taking off because there are a few pockets of planetary health throughout the country, but they're just that, they're pockets. It's not widespread, covering the whole profession and all the nursing schools. So we need some mandate to make this more standardized. And lo and behold, I think it was in February or early March, the uh, Canadian Council of Registered Nurse Regulators is going through a review, their 5-year review of curriculum. And so we're like, this is it. And we took this and so everybody got a link. Most people probably just got it in their spam or deleted it or whatever. So we knew that most people probably just deleted it. So we took the link and we sent it out again, but directed people within our networks that they should be advocating for planetary health. Skip all the other questions and just write planetary health in it somewhere. And to create more of a mandate and an impetus to do it. And we also got several people together, so people with some large voices, to get together with a meeting with one of the representatives for the CCRNR. And Jack is one of those people. And at this meeting, we discussed getting these into planetary health into the entry-level competencies. And they had already been thinking about this, and they had a couple draft competencies written already. So 7.5 was identifies how environmental factors, sustainable practices, and planetary health influence person-centered health and nursing care. And then 7.16 is demonstrates understanding of how healthy public policy and sustainable practices and planetary health approaches contribute to social justice and population health. These are great. They're a great starting place, but they still lack the comprehensive nature and the urgency that planetary health really demands. Climate change is happening right now, and it's having dramatic impacts. There's huge biodiversity loss, and there's huge amounts of plastic pollution and other pollution. We really need to address this now. So this needs to be even larger than those. And we gave that feedback back to them. So we're hoping to hear back more, but there's going to be new competencies released in August, and hopefully something will come of it and be implementable. Implement able to be implemented. Now, it's not just us who are working on this, though. Our American counterparts are also trying to do this, and they have a couple competencies um, in their that have been put in through their accreditation board. They have two accreditation boards. So we have um, regulatory colleges in all the provinces. The territories are a little different, but all the provinces have their own regulatory college. In the United States, they have. Oh, I'm at 10 minutes. Okay. I'll just sum it up very quickly. They want to get it into NCLEX. They've been working on questions. We're a little bit that's getting a little bit ahead of the game. I think we need to get it into the entry-level competencies at the college level, and then we need to upskill the faculty. Standalone lectures are great, but we need more than that. There's standalone courses, but even better, the goal, the best way of doing it would blend it throughout the curriculum, just like Trinity Western and Minnesota have done. So that's I'm at my time, so I will pass it back.
That was wonderful. Very excellent timekeeping, Rob. Thank you for sharing your story. I think it's important for everyone to hear who wants to make a change and nursing schools and beyond. Um, and it really struck me how strategic you were, like how to decide who are the people you need to talk to, how to understand like what the challenges are and how to creatively overcome them. And like leveraging the timing during a time of institutional change, I was like, yes, like that requires so much of the nursing process where it's like assess, diagnose, we're going to make a plan, we're going to do it, and then we're going to evaluate it. And really the importance of finding your people and mobilizing them in like ways that are going to be effective and not tire them out because like okay anyway I could talk a lot. We all want to do lots of work on this, but we need some strategic guidance and leadership, and I think you demonstrated that really well. Okay, our next speaker, this is wonderful. Our next speaker is Raluca Radu. Raluca is a nursing professional specializing in planetary health and climate resilient health systems. Her work spans clinical practice, academia, and global health, including coordinating Providence Healthcare's first organizational strategy on planetary health, as well as leading climate and health education at the UBC School of Nursing and at Doctors Without Borders, Médecins Sans Frontières. Please, Raluca, the floor is yours.
Hi, everyone. Thank you so much. Hopefully you can hear me okay.
Yeah, coming through.
Perfect. Thank you. I'm just going to start my timer because I can't see the screen. So first of all, happy Nurses Week to all. Thank you so much for the opportunity to join. A lot of the colleagues on this call, actually all of them, are people I look up to and really make this work purpose-driven. And so I just want to give a shout out to everyone on the call and everyone who's already participated in the webinars thus far. I managed to jump into the one from yesterday and it was really informative. So I'm going to dive right in. But before I do, I just want to preface the fact that my hope with my presentation, which I'm trying to take a storytelling approach to it, is really to help inspire you to see that planetary health education, as you've learned from my earlier colleague panelists, has no strict parameters. And forgive me, I'm looking down because I have notes to keep me on track. And it's really important also I'm hoping to showcase that through my presentation, that through the various shapes education can really take on, depending on the roles that you have and the places where you work. But before I dive further in, I do want to take a moment to give my ever biggest thanks for these lands that have actually greeted me here and welcomed me here. As I'm an immigrant to Canada, I came here when I was 12 years old in 2002. And I feel really grateful that I've been able to work alongside elders over the last few years and really understand
what this idea of engaging with not only land-based practice, but also engaging with a culture of gratitude as being a culture of reciprocity, and how that is really helping one align and live alongside on the lands where they're situated geographically. And so for me, that is on the unceded, ancestral, and traditional territories of the Musqueam, the Squamish, and the Tsleil-Waututh nations. So the territories of the Coast Salish peoples here in what's also known as Vancouver, British Columbia. I want to take a step back and actually start off my story by first putting the story of the nursing profession first. And I'm starting it through the renewed definition of nursing because I think it's an important place to kind of ground ourselves in the identity that we as nurses serve in our various designations, various points across the globe. And I think it's really important to remind ourselves of what that identity is at least seen and collated to be. But especially what I was very, very intrigued and happy to see from the International Council of Nurses last year was that they really made a deepened commitment to make sure that sustainable environments was a part of the core, essentially, competencies and drivers that essentially represent the nursing profession and a body as a whole. And if you read the actual full document, there's quite a lot of mention about planetary health and how that is hope to be seen in practice. And I think for me, I wanted to highlight here that just by the sheer fact that when it states to upholding everyone's right to enjoy the highest attainable standard of health, doing planetary health work is pretty much by definition also upholding everyone's right to enjoy the highest attainable standard of health. And I would also preface doing so with moral and obligatory responsibility towards the planet as well. So I am going to kind of start with my beginnings and kind of try to show my evolution in the short time that I have in terms of how planetary health education can look like and how it can be molded to the context where you're situated. So back in 2018, when I was a Master of Science in Nursing student at UBC, I was essentially very keen to take on the topic of the health impacts of climate change and the role of nurses at the center of that. Because at the time, I had learned about the wonderful work that Kane was doing locally here. I knew about some of the initiatives that were happening in the States, Planetary Health Alliance, Healthcare Without Harm, etc. But I still felt like at the time there was nothing specifically very granularly kind of targeting exactly what is the role of nurses in this space. And I had the pleasure of doing a practicum with the Association of Nurses and Nurse Practitioners of BC back then. And so this was essentially the result of that practicum, whereby I actually was able to work in partnership with the NNPBC Association to develop the position statement that pretty much kind of catapulted the next step in my master's journey to essentially create an educational tool for nurses, which at the time, again, was kind of just slowly building the foundations based on the amount of literature reviews that I was undertaking to try to understand really what is the essence of the nurse in the space of specifically working to understand climate change in practice, and what are those critical tools that nurses need to kind of enact that work. And I think a lot of that was actually even spoken to by my previous colleagues who mentioned their engagement in these spaces. So there's been a lot of transformation in this space, because as I kind of continued on my journey in the academic setting, I had the great privilege to work as a lecturer as well at the UBC School of Nursing. And the Nursing 290 course, which previously existed as an asynchronous course, I was essentially tasked with taking that course and transforming it to be synchronous. And one thing that actually Jack mentioned earlier in their presentation that really resonated with me was the fact that this idea of like making sure that we are not only teaching our students the theory, but really bringing the place-based learning into our teaching models. And that's exactly what I did with the course itself, in terms of really taking on an experiential approach for the students so that they can understand how local impacts do affect communities that they live in. And so essentially the case study on understanding wildfires, which I co-developed with my colleague Aubrey McCaddy, was a result of that experiential approach to teaching, and one that really allowed students to see themselves as stewards towards, of not only understanding what a resilience building means for the community level, but what it potentially they can anticipate to look like and apply it into other different kinds of contexts. And I think with that, I think it's really important to understand how to kind of use the places where you're situated and the platforms that are available to you, to share the knowledge and wisdom that you as nurses have. And for me, I think having the opportunity to engage with media and kind of share some of that knowledge through a nursing lens was really important to me, because it further solidified the voice of nurses beyond the bedside, which is traditionally known. And again, coming back to that new definition of nursing, the renewed contemporary model that nursing now operates within. Thereafter, I moved into a humanitarian space, and at the humanitarian level, planetary health education looks very, very different. And that was a huge wake-up call for me, because I needed to take a step back from the academic place. I needed to really engage in understanding the context and really do a lot of intentional meetings and discussions with colleagues and frontline staff who are leading operations from Asia to Africa, to the South Pacific and so forth. So it was really an opportunity for me to better understand how to tailor planetary health education specific initiatives to mold those contexts, and not do so solitarily, but rather in partnership, co-creating with those colleagues who are, after all, working with communities who are most affected by ever-growing climate change impacts. And so in my time at MSF, I was their climate and health educator. I had the great privilege of participating in a lot of different educational initiatives that I organized together with my colleagues from these different geographical parts of the world, to also being able to actually co-author the Lancet Countdown Policy Brief for MSF in 2023. And kind of leave a few essential toolkits that have now contributed to really helping staff to understand what decarbonization means in a humanitarian setting, and how to really use the positionality in terms of knowledge building in a way that is respectful of the communities that we work with, and most importantly, not imposing, but rather working together with, developing with, and in partnership, and not to. So it was very upstream related work. Then coming back to the local context, I want to make sure I'm on time, but I wanted to say that in my time at Providence Healthcare, a role that I am very, very grateful for having existed. It was actually the first of its kind role for the organization. And fortunately, thanks to an insurmountable amount of advocacy by a lot of amazing nurses who I deeply respect and love, the role existed. And it was the fact that I was able to step into it as a nurse and bring that wisdom forward. It was really a test for me to put everything I had learned up until that point into action when it came to building capacity for the organization. And that's that pillar here. So I highlighted this experience when I was a student myself, as I was also a planetary health lead with Healthcare Health Quality BC Quality Academy. I actually took that opportunity as I was learning quality improvement to build and also deliver 3 separate targeted interdisciplinary planetary health workshops to 3 different cohorts of new grad nurses, as well as different interdisciplinary folks who are coming through the organization. And it was a great place to actually see that, yes, indeed, when we actually even spent so as little as 20 minutes to provide a bit of a primer on what planetary health is and what it actually means and entails for that organization, it can make a huge difference. And as I'm nearing the end of the presentation, I just wanted to say, I think my favorite part of actually engaging in planetary health education is actually doing it through community-based participatory approaches. I found the most meaning come from the opportunities whereby we had events planned, and these are all examples from Providence Healthcare, really working hand in hand with the frontline staff, the people who are doing the work, and you're there to really provide the support at the grassroots level. I think for me that has been the most meaningful, because that is where I see the knowledge really stick, and those are the kind of experiences that people talk about. And so I think it's really important in planetary health education to transcend beyond the walls of a classroom, to go beyond the walls of just thinking about for instance, targeting waste reduction and thinking about how we develop adaptation models that can build community resilience, but really thinking about how are we working hand in hand with our patients frontline staff, people of different levels of leadership to make sure that the planetary health story is theirs and theirs to own. And so in closing, coming back to actually my mantra, which has been since day one, since I've been in this space, has been really taking that micro, meso, macro approach. I cannot emphasize enough that any step, no matter how small, incrementally at different levels, can and always will make a difference. At the provider level, really thinking about how we're shifting our own behaviors to align with sustainable practices. To the meso, whether it's university or your community or your hospital level, thinking about how are you building a community practice that you can sustain, and remember that there's strength in numbers. And also thinking the big picture, the macro, that how are we bringing all of these micro and meso level actions to build a larger movement that can really transcend and have an impact at the policy level, ultimately in the journey to go from the ego model to the eco, where we see ourselves as part of the larger system that we belong to. So I've left a bunch of resources, which for me have been instrumental over the years. Happily share these with you afterwards. And thank you so much.
Wow, thank you, Raluca. I have so much to say about your presentation. I mean, wow, what a spectrum of experiences. Engaging with media, engaging in interdisciplinary, international efforts, spanning the entire globe. I will quickly wrap up so that we can get to zero, but I did really appreciate how you emphasize the importance of community-based engagement and work in everything that we do in planetary health. Okay, so Ziru, thank you so much for making time to be here. Ziru is here on her lunch break from work, so we will quickly pass it over to you so that you can get started. Ziru is a pediatric nurse who is passionate about planetary health. She developed BC Cancer's Planetary Health Nursing Internship Program in 2024 and recently graduated from the University of Edinburgh's Master of Science in Planetary Health program. She's here to talk about her MSc research, and I will let you take it away.
Thank you, Ashley. Can everyone see my slides? Okay, I've never used this computer to do a presentation. Anyways, thank you for the introduction. My name is Siru. Happy Nurses Week, everyone. I hope you're all able to take some time today to celebrate the important work that you do. And I'm really excited to join this panel. I really look up to the panelists here today and have been generously mentored by many of them. I started off as pediatric nurse, oncology nurse about 10 years ago. I've since worked in several different areas in community, complex care. I'm currently in solid organ transplant. And yes, I apologize for joining late as I am orientating to a new job this month. Okay. And my slides are changing, right? It's all good? Okay, great.
Yes.
So I am joining from the West Coast from BC Children's Hospital, which is located on the unceded lands of the Hakoma speaking peoples, the Musqueam, Squamish, and Tsleil-Waututh nations. I am so grateful to be here and to be able to return here after my studies abroad to these beautiful temperate rainforests and coastlines in BC. So I'll start off with how I think about planetary health and how it relates to nursing, and then I'll move into my master's research. So this definition is cobbled together from the Planetary Health Alliance and some other leading voices in the emerging field of planetary health. So here, planetary health may be defined as a transdisciplinary field and social movement focused on analyzing and addressing the impacts of human disruptions to Earth's natural systems on human health and all life on Earth. Planetary health is grounded in indigenous and traditional knowledge systems that have always recognized interconnection between humans and nature. And planetary health evolved from the environmental movement, which expanded health definitions beyond the individual towards the ecosystem. So essentially, planetary health establishes that in order for us to be healthy and well, the Earth systems must be healthy and well. And so what are the Earth systems? This is the planetary boundaries framework. So there are 9 interdependent Earth system processes that regulate global stability, resilience, and they're sort of the life support functions. And so these systems include climate change, biosphere integrity, land system, and freshwater change, and others. And those are represented in each of the pieces of pie. And for each of these processes, scientists have defined a safe operating space for humanity. So crossing these boundaries significantly increase the risk of triggering large-scale, abrupt, irreversible environmental changes that threaten to destabilize life that we currently know it as. And so you can see the status of the 9 planetary boundaries here since 2015. The green area is the safe operating space, and the orange and red areas represent zones of increasing and high risk. This most recent update was released in 2025 on the right there, and currently we have surpassed 7 of the 9 planetary boundaries. They are beyond the safe operating space in the zone of increasing and high risk. And then, so what do the planetary boundaries have to do with health? Climate change is the most famous planetary boundary, but they all have implications on multiple dimensions of human health. This diagram was created from a Lancet article by Myers and colleagues, and you can see that almost all of the planetary boundaries. So there's pollution, climate change, biodiversity loss, land, and freshwater use on the left there. They impact all 7 elements of human health, and showing how important it is for us to not consider not only climate change, but all the sort of other environmental impacts that occur from human activity. And then this is sort of another image that helps us understand how global environmental change impacts human health. So on the left side, from left to right, this shows how our values and behaviors, so there are consumption patterns, for example, they cause environmental changes like pollution and biodiversity loss. And then these environmental changes result in exposures such as polluted air and water, decreased nutrient density in food. And then this all results in health impacts in the red on the right-hand side. And this is your, respiratory and nutritional diseases. This impacts human child development and reproductive health. And what's important here are the modifying factors. So those are represented by the oval lenses. They're sort of like the turquoise, blue, greenish oval shapes. And those are wealth, ethnicity, race, and gender policies. These are what I like to think of what we nurses know as the social, political, and economic determinants of health. So that's like healthcare infrastructure and social safety nets and disaster preparedness that shape whether communities adapt or suffer from environmental changes. And that's sort of the modifying factors are important to understand because we as nurses, as the largest health workforce and most trusted profession globally, we're really uniquely positioned to help shape these modifying factors. So we can strengthen the healthcare resilience. We advocate for and protect health equity for vulnerable populations. And we, as you can see today and from sort of the events of this week, we can influence social and political change through our presence as community leaders and leveraging our voices. I won't go through sort of the reasons to teach planetary health because I think the other speakers have talked about it and they've also talked about some of these documents. Rob and Luca have referenced, the renewed definition of a nurse from ICN that came out last year and also the CASN framework. So moving on to my master's research. This was conducted in partial fulfillment for my MSc in planetary health degree at the University of Edinburgh. So the purpose of the study was to explore nurse educators' conceptualizations of planetary health and their perspectives on the competencies, challenges, and strategies needed to successfully integrate planetary health concepts into nursing education. My motivation for conducting this research started with wondering why planetary health wasn't being taught in more nursing programs, which many of you probably have thought about. And so there is the planetary health education framework, which provides a structure for nursing programs to teach planetary health. At the time of my research last summer, only 3 schools in the world had reported systematic integration of this framework into their curriculum. And then in climate change and sustainability focused education, most existing research looked at student perspectives, while nurse educators' perspectives are quite poorly understood. And so the literature showed that nurse educators also often conflate planetary health with single concepts like climate change, sustainability, and that demonstrates limited understanding of how comprehensive planetary health is. And then there are lots of calls to action for planetary health integration into nurses' education, but there is a gap in understanding how to actually empower nurse educators to do this, right? Nurse educators are key to preparing this planetary health literate workforce, like Rob was talking about earlier. So I really wanted to sort of understand and hear what nurse educators' perspectives are. And so my findings were that nurse educators recognize this is a changed and changing world. They have an understanding of the interconnections between human and planetary health. They had a confrontation of humanity's impact on the environment and the recognition that planetary health represents sort of like humanity's endpoint for the expansion of a health framework. If we think about it, like if planetary health is an expansion of public or global or One Health frameworks, this planetary health framework is really sort of the endpoint to where we can go from there. When envisioning the future nursing workforce, educators describe new competencies that need to be taught. So understanding how climate change and pollution impact human health. And educators had a vision for the future workforce that included expanding nursing care towards the planet. And I love this quote from a participant. She said that nurses are curators of health and care, and then actually of the planet, because it's so intrinsic to the work that we do as people within this ecosystem. Um, and educators anticipated challenges and opportunities with implementation. The PAC nursing curriculum was the most identified challenge, and regulatory standards were seen as both challenge and opportunity. And all participants were receptive to the change and understood the urgency here. And so the research findings are mostly supported by existing research, existing evidence. And yeah, in the interest of time, I'll just sort of discuss the novel findings on the right-hand side. And so, oh, is it working? Okay, cool. And so when asked about whether global environmental change, such as climate change and pollution, impact what students want to learn, most participants said no, and one educator responded that they didn't know that we haven't asked them. We haven't asked students whether they want to learn about these topics. And this contradicts the literature, which show that the majority of nursing and health profession students believe that these topics should be taught as part of their education. And so the perception gap could stem from educators' sort of own limited planetary health knowledge, their own protective concerns about catastrophizing or making students feel ineffectual, that we're bringing problems that are sort of too big into the classroom. And then a lack of awareness about student desires, and also an incomplete understanding of planetary health. So maybe they weren't able to identify topics that students are interested in as sort of under the umbrella of planetary health. The second unexpected finding is really important from a philosophical or epistemological stance in the ways that we know. So this finding is also influenced by the historical and geographical context. The study participants here were all from a single university in the United Kingdom. They did not demonstrate understanding planetary health as long-rooted in Indigenous and traditional knowledges, unless they were given a definition that explicitly said so in the topic interview guide. And so this may be because in the UK, planetary health is typically defined as arising out of sustainable development, or the planetary boundaries framework and other sort of health frameworks from the Western world. And when some of the participants were given this definition that positioned planetary health as old knowledge that's existing in other knowledge systems, they were able to then reflect on the ways in which they learned environmental values from other cultures, or through research collaborations and colleagues in other parts of the world. And for participants from diverse backgrounds, they didn't talk about how their own cultural knowledges and values shape the ways they relate with nature until they sort of got this definition of planetary health. And so this sort of speaks to the creating space for intercultural dialogue, and highlighting the need, right, that we need to sort of have and demonstrate cultural and knowledge humility when we're working towards teaching planetary health in these colonial knowledge systems. And so quickly on the future directions, for research rising out of the two novel findings, we need to better understand the educator-student perception gap, which could be key to successfully integrating planetary health into nursing education, and then also sort of exploring how epistemological humility eases intercultural dialogue and how that may give us insight into how to honor and engage with diverse ways of knowing and being so that we can build systems that are good for more people. And then we need to educate nursing students on planetary health, but this needs to also be really done mindfully through hope-based and solutions-oriented pedagogy. These are heavy, big topics. And then we need to connect nurse educators with area experts and resources to actually be able to do this. And then policy. I think my colleagues today have talked a lot about the various ways that they're grounding planetary health transition in nursing governance. And so these are our ethical codes or regulatory standards, right, for education and practice. And then just quickly on limitations, this was a single site study which limits the transferability of findings, and the recruitment style may have introduced volunteer bias. And also the absence of student voices limits understanding of the educator-student perception gap. So yeah, thank you for listening. Yeah, and Autumn, or Ashley maybe will be sending out the planetary health primer for nurse educators that I created as part of the knowledge translation from this research.
Thank you so much, Siru. Yes, I believe Autumn is sending all of these resources that all of the speakers have given us. Siru, I know you have to leave right away, so this is officially the start of our panel style question and answer period. So since you have to leave, I hope you're okay if we start with you. I only have one question for you anyway. Hopefully it doesn't take you longer than 3 or 4 minutes to answer so that you can go and eat some food before you have to go back to work. I just want to quickly say that it's always so wonderful to hear you speak about your research. I have heard you talk about it for like a longer period of time. Always great. I was most surprised to hear that only 3 nursing schools in the world have systematically integrated planetary health into their curricula. I think that shows how important this work is and how needed it is right now at this zeitgeist, at this time. I would like to start with the question of kind of broadly, if you had the chance to give advice to someone who's contemplating doing a Master of Science in Planetary Health, what advice would you give them?
Thank you. That's a really good question. I think so if we think about the Master of Science degrees that are available, right now the Planetary Health Alliance has a list, and it has grown by, I don't know, maybe 4 or 5 times since when I was looking for a program a few years ago. I think context is really important. I think yeah, context is really important. I think that because we in sort of in Canada and in the US, because we're living on land, and especially in BC, this is unceded land. There's a lot of conversations about how we need to learn from the knowledge that exists here, right? And all about the colonial history and how we're the colonial history, the colonial presence, and how we're all trying to sort of do like advanced planetary health in the way that creates the least harm for everyone, and also repairs. And it's very interesting to be in Europe because I think a lot of the planetary health programs are in Europe right now, in different parts of Europe, and that conversation isn't really at the forefront. And so I think, yeah, and it was very interesting to go through an entire planetary health program and like not have sort of any Indigenous courses. And sort of instructors all from like a European Western centric viewpoint, and not even really talk about that might be, yeah. And so I think that's something to think about, but I mean it is a wonderful new field, and I learned a lot, and yeah, and it's evolving as we speak. So the planetary health degree, that like the program itself was very, very open to feedback and openly listened to all of the feedback that we had given them. And a lot of this was sort of like epistemological humility feedback. And so it's constantly evolving, and you know, who knows, maybe they're doing much better now. But I think, yeah, I think that it's very exciting to do a planetary health degree because it's changing so quickly. Yeah, I hope that helps.
Yeah, that was wonderful. Oh, wow. If anything, everybody I mean, for all of you who are thinking of doing a Master of Science in Edinburgh, now you know what the gap is. We need to talk about the inclusion of Indigenous knowledge systems in European planetary health educational frameworks. There's the gap. Siru, thank you so much for being here during your lunch break. If you have any closing remarks, feel free, but that was wonderful. I hope you have a great day.
Thank you. I'll try to stick around for a little bit longer, if that's okay. I'll stick
Yeah,
along for as
as
long as
long
I
as you
can.
can,
Yeah.
and
Okay.
you can just zip out whenever you have to.
Thank you.
Okay. So I saw that we have a question in the Q&A that has tentatively been answered. It was directed at Rob, so we'll start with Rob. Jack did answer it, but I'll also give Rob an opportunity to answer it since he hasn't texted into it yet. So Rob, do you have any, this is from Bridget, do you have any resource regarding greening the lab? I think you mentioned it during your talk. so that other schools may replicate or attempt to make their own labs more sustainable. And Jack, I might also pass it to you after if you want to elaborate on what you said in the text. Rob, please.
I don't know, but Jack would know probably a little bit better on the Greening the Lab resources available, but the University of Alberta has done a little bit of work there as well, but it's not open source. What the information I received there. Cascades has lots of stuff. Um, there's Algonquin College is putting out a new article about the project that has happened there. I don't know the release date of that yet, though. But I I was very specific about one lab, but I don't have a lot more on open source knowledge to share. Sorry.
So
that's
like when it comes to open source, U of A collaborated with Kane to create the Greening the Labs. And so if you're interested in reaching out for that, then I can make like a warm connection to be able to access that. But with the Cascades playbook that Raluca had put in, that's like a really, really good start. The other thing to take a look at is they have a planetary health report card that then assesses where your school is at, and that can basically be a baseline. It's kind of like doing an environmental scan of your establishment to see what's missing, because you need to start to see what is missing first to then know what needs to be done. So I like getting started, but like to get kind of the staff and the buy-in to have everybody realize it's important. I think starting with like an environmental scan and what we're actually doing, because it's surprising how much people are actually doing without calling it planetary health, especially if we think of place-based and grounded experiential learning, and with that strong focus on equity and social justice. So
yeah, and I see the chat is also blowing up about this. Thank you, Jack and Rob, for talking. So it looks like we've also got resources, Bridget, for you at Cascades, as well as Aurora College has a Greening the Lab project. Kathy says that. So
I also
um,
just put another resource in. It's called the Association of Faculties of Medicine of Canada. Created a roadmap on planetary health and sustainable health systems, and that was led by Dr. Courtney Howard, but there's several of us probably on this call who were involved in the consultation of that. And there are several political policy steps, including getting planetary health into into entry-level education. So
and Nicole has also said that lots of schools have their own Green Labs programs. So you could start with like a general Google and see what schools show up and what you can kind of like emulate and replicate from that. Okay. Unless anyone wants to jump in, we have another question in the chat. Thank you, Aggie. So the question is, I understand that Accreditation Canada is close to rolling out an accreditation standard related to sustainability and planetary health. Will the existence of this sort of standard nudge nursing educational institutions to include more of this topic? It is not directed at anyone. Would anyone like to start off the discussion around this?
if I start, I might be a bit too controversial. So I find sometimes pre-licensure nursing programs, they only start doing the implementation of whatever once they're mandated to. So what we can see that, for example, with the Truth and Reconciliation Commission is the calls to action. So once that came out, people were like, oh yeah, maybe I do have to integrate Indigenous perspectives and be respectful. But until it was integrated into the entry-level competencies and practices, people didn't think of that. With Accreditation Canada, Aggie, are you talking about like Accreditation Canada for hospitals and tertiary care centers, or more for like establishments themselves?
I'll just chime in. So this is a new HSO standard that's coming.
yeah,
So it's supposed to be like national across the board. Yeah, Aggie acute care. But my understanding from some of the early discussions I've participated in was that the idea would the nice to have idea would be to have this as sort of like a propelling into the next step, which I think is the hope to see educational institutions to include more of this. So I think it's supposed to serve more as a launch pad into that
Okay.
step. Yeah.
Well, that's the idea, right? So that's where we're trying to be strategic and like going with every area. So we're working with the Canadian Association of Schools of Nursing, integrating planetary health into the competencies and expectations. And then we're working with the entry-level competencies, because unless it's an entry-level competency, even if Accreditation Canada says for acute care, it won't necessarily be done, because even with, if you look at, for example, a recent article that came out that speaks to the erosion of community health in undergraduate nursing programs across Canada, since we've moved to the NCLEX, that has a more open focus on acute care settings where apparently students want to go to work. They have diminished the amount of community health content in undergraduate baccalaureate programs. So that's in essence, as planetary health champions, and to be planetary health champions, we have to think of different ways of teaching and pedagogy. We have to think of the Indigenous roots and being able to see multiple perspectives. It goes beyond just planetary health. It goes to like, people need to learn different types of pedagogy. People need to learn equity, social justice. Then you knew about environmental racism. It's bigger than just like, oh, we're integrating planetary health and we're going to put it into, a word in there in a couple places. It's almost like a way of being, I feel.
I just want to go
So,
back. Oh, sorry.
no,
Are
go
you, are you
ahead.
done, Jack?
No, so that's why it's really important to look at the entry-level competencies, but it's not just getting it in there. It's almost like showing the way, right? So like that, the Zero's guidebook that she created, Raluca's journey, that really emphasizes that experiential learning, and even the curriculum guidelines that the Planetary Health Alliance has put out, it doesn't explain the how, right? It explains the what. And this is what's missing. It's the how. Go ahead, Rob.
So what Aggie was speaking about was the Accreditation Canada Health Standards Organization work that they're doing. And I believe that started in early 2024. And I don't know, Raluca, you may have been on the group. Were you on the panel, Raluca, advising? Okay, I know Maya Caliguru was on that panel along with Dr. Courtney Howard, and I think Miles Sargent's leading it. Um, but it is, I don't know the details of it, but a lot of that was coming from the sustainable procurement side to try to, because medication, supply chain, and all that. It's about 2/3 of healthcare's environmental impact. So some of it was coming from that, and some of it was coming from the other sustainability lenses as well. And I believe it's going to be a standard similar to an ISO standard, um, around various things that the institutions have to meet. So acute care, tertiary care is one, but I do know that Accreditation Canada also credits um, some community health institutions as well. When I was doing community health nursing, it was accredited by Accreditation Canada. So I don't know the scope of where it's going to go. It hasn't been released fully, but it's that's, I believe, the direction it was going in. And hopefully that will have some spill over into education as well, though I don't know for sure.
Wonderful, thank you. Raluca, you're good? Okay, great. So thank you, Aggie, for your question, and Bridget. Again, if anybody in the audience would like to pop in a question here in the Q&A, I did get one in a private message. So I do like asking this question as well. So this is just to the panel generally. What is the most challenging part that you've experienced in bringing planetary health education into somewhere that you're working, whether it be clinical or classroom based? Um, and what helped you overcome those barriers?
I can speak to that. So I think one of the things that Zero mentioned, and I won't speak to that piece, is around like academia. I think the challenge just constantly is the curricular overload. I feel like it's the generic. I call it an excuse. I name it because it is an excuse. I think that we ought to transform our educational systems beyond just nursing, like to actually adopt a planetary health lens. And I may be biased, but I think that it is a systems shift that needs to happen across all levels and disciplines. So I think for me, I've kind of moved away from that thinking into more solution seeking. But one thing that I wanted to speak more to, having had this recent experience at the in the clinical operational role, is I think the most challenging part is that you don't like staff don't have the time to engage in PD. And if there is professional development, they have to go to the sessions that are related to clinical skills, upkeep, or anything that's very specific to the organization they work for. And so that the union or whatnot will cover. And I think what I've tried doing in terms of the your follow-up questions to like overcoming the barriers is I have like some of the the workshops I created were very actually the last thing I created, and my role ended because it was temporary. So I did not get the chance to actually pilot this, but my hope is to actually make it more widely available, is actually having like a rapid style approach to doing sort of place-based, like quick 5 to 10 minute rounds. And that seems to be really enticing to people because you go meet them at the bedside. You are not asking them to come out of that setting. You go to them, and you cover a topic of interest. And the other thing is like really, I think these sort of sustainability fairs, like I think one of my images in my presentation had a picture of us at a sustainability fair, and it was these kind of events really do bring a lot of people together, because they come there to learn, they come there to engage with the different departments and services where they're kind of promoting their work. So, for instance, we had food services sharing their different plant-based menu items that they have. And so I think ultimately my sort of solution to overcoming barriers to planetary health education in the clinical setting is really to create fun events that bring people together to celebrate all wins, and then in small little nuggets. Sorry about the I live in a hospital corridor, which makes it challenging if you hear the alarms. Um, is really making sure that you're identifying quick and easy ways to meet staff where they're at, and try to shift away from like the traditional classroom style model where you get people to sit in and like learn about the topic. You go to them and you engage with them. So I have some tools on that hopefully in the very near future will become available as op-ed resources.
I think that the barriers are kind of the same barriers that healthcare is facing in general, like in education, packed curriculum. And then in the workplace, it's understaffing and underfunding, meaning patient loads are really, really high. And those are always the barriers you can get around them. And I think has Reluca has some great ways of getting around those barriers there. Um, but I just also want to come back to why those barriers exist. And our system is underfunded right now, and nurses are worked like the patient ratios aren't safe. I know British Columbia has some minimum patient ratios, but Ontario doesn't have that, and a lot of the other provinces don't have that. And if you look at like evacuations and if from a climate adaptation lens, things are going to be getting harder and harder and harder. And if you look at when in 2023 Yellowknife was evacuated, and when Yellowknife was evacuated, somebody had to be able to host all the people that were being evacuated. So that's the ICU patients, labor and delivery, long-term care, ALC patients, all the medicine patients, but also the outpatient dialysis and all these other people who posted them. Well, a lot of them went to Vancouver. And I don't know, I'm not in Vancouver, but Raluca, are you guys well staffed in Vancouver?
I think the answer is no.
So if you're not well staffed there, like you need for adaptation, we really have to up staff and put invest in our healthcare system so that we can be able to roll with the punches that are coming.
Mhm.
So we need that investment in our healthcare system to roll with those punches, but we also have to teach about where those punches are going to be coming from.
Yeah.
So we have to put that education in place so that people expect it. It's not just going to get mysteriously get better. It's going to be getting much harder unless something
Mhm.
changes fast.
So I think that's where in planetary health, part of what we're teaching is systems thinking and movement building, right? So if we're going to be teaching this in pre-licensure program, we have to have systems thinking and movement building. With that systems thinking capacity, they're able to, and maybe I'm always going to be a dreamer, right? Because I know this is a marathon, not a sprint. I think part of it is you need those tiny wins. But the barriers are more than that. So we're talking about being understaffed, but the nursing is also a majority female profession. So to get a voice at the table, it doesn't always happen. So part of the advocacy piece and part of being able to get planetary health in the pre-licensure program is to be able to have more visible representation of nurses doing this work, right? You cannot be what you cannot see, right? So if we're not able to bring concrete examples in our practice, we're not able to show students and other people that, hey, you know what? You can be a planetary health nurse and it could be your job. And teach how to do the advocacy, the media, and all that kind of stuff as well, right? So for me, it's beyond that, right? So the advocacy, if we're looking at a systems level perspective, we know as nurses that nurses are ideally suited for place-based local adaptation and mitigation, right? We know this because it's part of how we're taught and who we are. But other professions don't know this. So a concrete example I'll give you, we did a gathering insight sessions with a bridging the gap in planetary health risks um, in the perinatal period. And I was presenting on the point of care assessment tool, the PeriFat, and the OBGYN in the room was like, oh, but we don't have time for that. It would have to be the nurse doing the point of care assessment. I'm like, that is actually perfect. The nurse would have time to go over everything and then find the resources. The idea is you have the best provider at the right time. And if you're already in a clinic, that you have a nurse doing an assessment before the OBGYN sees them, you have time to integrate it. It's perfect, right? So for me, I'm like, wow. So it's also part of it is communicating the role of a nurse within planetary health and being able to take hold of the space, right? Because we're not there yet and we have to take the space. And it's not just ask for the space, we have to take for the space. And that's where I like hearing about Rob's and I like hearing about Raluca and I like hearing about Zero. We have to take the space, not own it, because we can take the space and walk with. And I think that's where we really shine. But to do that and to integrate it into undergraduate education, we have to teach and we have to walk with educators who aren't used to doing it that way, right? How many of your colleagues are so used to teaching in a magistral type way where like they're talking to the students with a PowerPoint? That, like most of you in nursing school, that's probably how you were taught, right? It is tough to be able to have the experiential learning and having difficult conversations because when you're talking about planetary health, you're going to inevitably talk about difficult things like environmental racism. And some people have those blinders. So you'll be able to navigating all those different situations. So part of teaching and increasing capacity to be able to integrate it is still looking at those base things and health, like health equity, social justice, environmental racism, those things are concrete and they exist. So that needs to be made aware. And then you have to figure out the strategy. Hey, did you know that if we end up greening the nursing lab, we'll save money? Right? So like little things like that. So like it's part of knowing what tactic to use. And that's where the systems thinking and movement building comes, right? But every school needs a champion. And every champion needs a circle, right? Because it's tiring, right? So you need to be able to like pick up the phone and say, hey, Ashley, I had a crap day. I was trying to do this and it didn't work. I just need somebody to say, it's okay. You got to keep going, right? So that's part of it. You're probably going to be alone. You're going to be working towards it. You need to find your people. You need to continue walking with and then trying to get there and incremental, celebrate the wins. But there are barriers, like everybody mentioned.
It is such a privilege and a pleasure to be here with you all, hearing these wonderful and insightful ideas about what we can actually do to get planetary health kind of soaring through everything, through academia, through clinical practice. Um, so there's a lot of different things that we can talk about here. I think we have time for one last round of discussion. Um, case-based learning when teaching planetary health. So since this is the education webinar, and I would love to hear a little bit more about like what kind of successes that you have had and what gets you excited. I guess this is going to be a pretty broad question, but you've all held a variety of roles, and I just want to hear anything you would like to say about what you've learned about building capacity through different populations or institutions, and specifically, what educational wins do you find are the most valuable? Reaching out to people. This can be
So
either people who are like already on your side or people who, have not been, I guess, converted yet. Can I say like
I
converted?
I don't know if this quite answers the question, but I had a student last year who had been in the lecture I did the year before on planetary health. And she remembered it from the case-based learning that I did with it. And that the fact that it stuck with her and it made an imprint on her versus just being, just another lecture, that that felt impactful to me. And that I think is also capacity growing because you're gaining people along the way. But I just wanted to describe how I do case-based learning so like I do a brief lecture on planetary health and how climate change affects things and how um I definitely am more climate change heavy with how I was teaching, but I teach about the other things as well. But then at the end of it, I break the room up and it's usually about like 60 to 80 students in the class, and I break them up into groups and I've developed 11 different case scenarios, and I have them do like a tabletop exercise at how you'd address it. There's one that's a zoonotic disease that I don't tell them it's a zoonotic disease. It's just this mystery illness, and how do they deal with it? But they all were outside. They got bit by some kind of insect. Or I have another one where they have to do an evacuation of a facility, or they're with MSF and they have to deal with lack of water, or but it forces them to think outside that box because, as Jack was saying, it's all very tertiary care heavy in a lot of undergraduate education right now. But thinking outside of that tertiary care box and into the larger system box, you can really implement case studies in that and get them thinking about all the different dynamics and logistics that pull into it and the broader scope of nursing. So,
I think for me, oh, did you want to respond to that, Ashley? I think for me, it's the walking with and mentoring students along the way, right? So if a student is interested and wants to learn, you bet you that I'm going to be walking with them, right? So having like increasing like students placed with cane, for example, for leadership or for if you have leadership placements or if you have community health placements, placing them where they're able to learn how to put the case-based in class learning in real life is really cool, right? So, and to really ask the right questions to lead them into that critical reflexivity, right? So part of what I do as well is I will partner with Indigenous knowledge keepers and elders, and incorporate that within the actual training itself. So for those of you who are able to come to the Advancing Place-Based Planetary Health, it was co-created with several people from Kane, including equity denied communities, but we walked with Elder Lionel Houston, an Anishinaabe elder, who helped with where to integrate those Indigenous groundings and knowledge. So it's not so much about coming off as the expert. It's like, let's find the information together as well, right? Because it's a lifetime, and just giving examples and showing, right? So that's a lot of what I do. And with experiential, we will actually walk and learn. So like when it comes to land-based learning, we will actually, instead of just doing a case study, we will actually walk over to like the Seine River, which is like a 10-minute walk from the university, and just stare at it. And like I've integrated photo essay activities in certain courses where they're actually creating their own case study by using a photo essay related to a planetary health risk that they see in their neighborhood, for example.
Thanks, Jack. Okay, in the interest of time, we'll pass it over to Raluca, and then I only have 1 minute of closing remarks, and that will be the end of our time together.
Yeah, and I think I'll be brief, and I'll just share that ultimately, just also from what my colleagues mentioned, and I was going to mention this as well. I think it's really important to know that there's no one size fits all that will, something that will work in a local clinical institution will not work at maybe the same type of institution in a different province or in a different country. And I think that's something I've learned the hard way when I worked at MSF. Because again, I was coming from an academic like an academic sort of school of thought. And I'm really actually glad I stepped away from academia for the purposes of actually getting this sort of boots on the ground experience, where once you get out there, it's very different than what the theory in the classroom looks like. So if you asked me to teach the course today, I would scratch everything and like do it all from scratch. I will build it all from the ground up. And I think it's really ultimately the biggest takeaway and lesson is really approaching it with humility and curiosity, and knowing that the learning in the space will never stop so long as your heart stays open to doing the hard work. And I think most importantly is making sure that you do this hard work with people who are your allies, and know that you're not meant to carry planetary health movement building on your sole shoulders. Like there's shared shoulders to move it around. And that's kind of been my biggest lesson going forward.
Thank you so much, everyone. All of you, and Zero, although she couldn't stay the entire time. I really love thinking about how we can uplift everyone, every person. I think every nurse is a student forever. And it's really important to think about how we can continue to promote education through, as you've all said, these wonderful examples of like case-based learning, incorporating Indigenous ways of knowing systems and complexity and movement building, and learning about that, and having in-person and land-based learning activities. So excellent. So as we approach the end of our time here together, I'll quickly share my screen so that you can see these wonderful speakers have generously offered to share their contact information with you. So if you would like to collaborate or reach out, of course, I've seen some requests for some resources. Here you are. There will also be resources sent out afterwards. I want to first thank the speakers for generously sharing your time and insights today with everyone. And I also want to thank you, our audience, without whom we would be speaking to an empty room. So thank you so much for making time to learn about some of these brilliant initiatives happening across Canada. We hope to see you at the next session, which is tomorrow. Please be well, and remember that we're all part of a really powerful global community as we pursue sustainable and equitable healthcare for everyone. So have a wonderful rest of your day. Return feeling rejuvenated. Goodbye.